Hello, students. How are you doing? It's like today's our lecture, Pathophysiology number 14, and there is some kind of problem with my laptop's web camera because you can see only my shadow, yeah, unfortunately, but so okay, I think it's okay. You can only see my shadow, unfortunately, but anyway, yeah, today we have like another lecture. I've been waiting for 7 minutes, 5 minutes, and you haven't joined me yet. Hope you will join me later, but if not, that's not a problem. So I'm recording this lecture for you, and you will be able and you will have the opportunity to see this lecture later. Yeah, so when you have a time for it. What about our lectures? So it's like our 13th lecture. On Thursday we will have 15th and the last lecture of our class, of our course, and you will be done with the pathophysiology. Yeah, so hope you enjoyed this subject. So hope you are interested in subject. Hope you have so Joseph, hello, welcome. Can you hear my voice? So there is some kind of problem with my web camera and you can see only shadow of mine, but that's okay, I guess. So now saying before you joined, I have started my lecture for like 1 minute. So you have joined almost on time. And I have said like that it's our today's 14th lecture. So we have 15 lectures in our course of pathophysiology. So the pathophysiology will be over next Thursday. So we won't be seeing each other anymore. Yeah. So I hope and I think that you have enjoyed these classes. So you have enjoyed the subject. You have understood the main concepts and main things about the pathophysiology. So you have understood that the importance of the pathophysiology and hope that you understood the mechanisms and everything I was trying to and I was explaining to you. Yeah. So good for you. So you have written down the lecture, the second midterm examination, if I'm not mistaken, and we haven't seen each other since then. Yeah. So So how was your exam? I want to hear some kind of feedback from you. So are you satisfied? So this was too hard, too easy for you, or it was normal? Or how was your exam in general? Yeah. So it was good. Okay. So I have seen your points. You had like 22.5, if I'm not mistaken. Yeah. Yeah. So that's a very good point. Yeah, good for you. Congrats. You have really studied. You have attended my classes and etc. And you have made the good results. So good for you. Congrats once more. Okay. Now we can move on to our today's topic. Today's very interesting topic. So each topic, when I'm starting to discuss, I say that it's interesting. Yeah, but I'm not saying that like it's like the template for me or something like this. It's really interesting and really important each topic because each system and each organ system and the diseases make together our body, and we have to be aware of our body, and we have to be aware of our organisms of our patients, yeah, in order to know the different systems, and these different systems in a whole make the whole body, yeah, with which we have to deal throughout our career and our practice. Yeah, so today we're going to review, according to the syllabus, we have to review the musculoskeletal system. So the musculoskeletal system is very important system. So it's responsible for almost everything we are doing. So for example, when you, so for example, now you are sitting, and then you are listening to my lecture. That means that you are maintaining your posture, and maintaining your posture, and the responsibility for this has the musculoskeletal system. So your muscles are flexed. That's why you can sit. You can maintain the one posture or something like this. So my muscle work much more, because I'm communicating verbally, non-verbally, and this other thing. So the communication, because the tongue is also the muscle. And the other thing is made by the musculoskeletal system. So for example, when I'm talking, I'm using my hands, gestures, and etc. And this other thing is linked with the musculoskeletal system. So the musculoskeletal system is like our everyday life. We are using our muscles, we are using our skeleton, and I think in order to live from day to day. So that's why we have to review the musculoskeletal system and the associated disorders which can be linked with the musculoskeletal system. We will review it first. Traditionally, we will review it first, like the anatomical and physiological, normal anatomy and structure and function of the musculoskeletal system, and then we will go, and then we will move on to the associated disorders. So this will be like the plan of our today's lecture. Now I will share a presentation for you over here. So can you? There's something. So I'm losing the other laptop, and it has some kind of, it doesn't work too quick, and it's sometimes lagging. But so can you see my presentation? So Joseph, can you? Yeah, okay, very well. Okay. So this laptop is also working. So as I have said, the musculoskeletal system and the associated disorders. So let's go through the functions of musculoskeletal system, and why do we need to know these functions of the musculoskeletal systems, and we will review these functions, and you will understand how important this system is. So the protection for internal organs and to provide support to soft tissues. It's like for example, the liver is protected by the ribs. Because the liver is located under the ribs. Also, the same thing we can say about our heart, because the heart is located in our chest, and this heart and the lungs and the thoracic organs are secured from outside and protected with a rib cage, and also vertebra, and all the skeletons, all these bones, and also the muscles from outside. That's why it protects like our internal organs and the vital organs and important organs. The same is with the brain. For example, the brain is located under the skull, and this skull is like the defensive thing that defends our brain from the damage and other things. Also support to maintain an upright posture, maintaining the posture, for example, when you're sitting or lying down the bed or something like this, your posture should be maintained, and this is like the main function of that is provided by the musculoskeletal system. So the blood formation. So this is the very strange thing to think about it. Because how can musculoskeletal system have a role in blood formation? Because we know that the blood formation, the hematopoiesis, happens in the bone marrow, and the red bone marrow, like, is located in the spongy bone. We're gonna review it later. We have like two types of compact bone and spongy bone, and in the sponge bone we have like red bone marrow, and red bone marrow is responsible for hematopoiesis. So the blood formation is mainly the musculoskeletal system has also the role in blood formation, because that it contains the red bone marrow. Also the mineral homeostasis. The mineral homeostasis, if you remember, and you have to remember, and I think you will remember it because you have written down the exam very well. That means that you have studied the endocrinal system, and in this endocrinal system, I have mentioned that we have like the thyroid gland, and then and on the back side of the thyroid gland, we have the parathyroid glands, and these parathyroid glands are responsible for producing the parathyroid hormone, and the parathyroid hormone is responsible for maintaining the normal calcium level in the blood. So it's done by the so when we have like it's linked with the bone, and the bone is responsible for the mineral homeostasis, because in the bone we have like a lot of, it's like the pooling and the deposition of the calcium, and when our blood needs the calcium, bone has an ability to release this calcium in the blood and to maintain the normal level of the blood calcium. And it's like the one of the roles, so the mineral homeostasis, storage and release of minerals as the body requires them. The bone store most of the body's calcium requirement, and also the phosphorus, and also magnesium storage. And also not only minerals, but the fat and minerals in the yellow bone marrow are also stored, and they leverage working with the muscles and the bones in the upper and lower limb, pull and push, allowing for movement. So just simply the movement is like the main functions of the musculoskeletal system. So let's go for on our next slide. So here it's like the skeleton of our body. We have approximately 206 bones in our body. It's like the skull, jaw, clavicle, humerus, ribs, over here, humerus, radius and ulna, phalanx, femur, tibia, fibula, phalanx, pelvis, ribs, spine. Sternum, scapula. It's like the huge bones in our body and the big bones in our body, and these bones are mainly they form like the whole skeletal system. And this system, I believe that you have learned in the anatomy in every detail. So every incisura or every fossa of each bone, you have learned it and you know it, and I'm not going to review it now. So I just want you to remind you this. So we have like 206 bones in our body, and these bones are linked with each other, and they form the like joints. We're gonna review the joints later. And let's now review the structure of the bone. So we have different. The bone structure is classified according to its form. So it can be long bone, short bone. So the long bone is the femur over here. You can see it's like the long one. So can you see the presentation and you can see the details or not? So should I make it much bigger, or it's okay? Okay. So not this one. Over here, bone structure of long bone structure, so as you can see here, the femur is like the long bone, and the phalanx are like the short bones over here, and the tarsal bones here are like the short ones, and also the flat bones, which are ribs, irregular bone, the mandible, because they have like the irregular shape, and also the sesamoid bone. It's the patella. Patella is the bone which secures, it's called sesamoid because it is like embedded into the ligaments and tendons, and that's why it's called the patella. So the patella is the bone which we have over here. So when we talk about the knee, and it's like the outside of the knee, it's called the patella, and the patella is sesamoid bone. Because of it's embedded into the ligament and tendons, and the bone which is embedded into the ligament and tendon, and ligament and tendon is called like sesamoid bone. And then the bone structure, let's review not only the shape and form, let's review the bone structure in histologically. So the bone is as you remember, I have said that the bone, we have reviewed on our first lecture, that the bone is like the connective tissue, and it's like the dense connective tissue, and its density is, and it's like the collagen matrix, which has calcium, magnesium, and phosphorus minerals in it. So the upper it, it's like it has in it, and these minerals are responsible for like the density of the bone, and the more minerals we have, that means that the more dense our bone will be. And the density and the hardness and the toughness of the bone is maintained by the matrix, also by the collagen fibers, which are also very hard, and by the minerals such as the calcium and not potassium, calcium, phosphorus, and magnesium. So the main thing is the calcium. Calcium is responsible for the hard structure of the bone. Yeah, and also we have like the two cells in our bone. It's called the osteoblasts and osteoclasts. Yeah, and the osteoblasts are responsible for forming the bone, so they are responsible for forming the collagen matrix, and they are responsible for putting the calcium in this collagen matrix. So they are responsible for bone formation. And we have like this, we have like the opposite of the osteoblast, which is called the osteoclasts, and these osteoclasts are responsible for bone breakdown. So when we need the bone to be broken down, it's like the responsibility of the osteoclasts. Yeah, and now I want you to remind you the parathyroid hormone, and as I have said, the parathyroid gland and the parathyroid hormone gives they makes bone to release the calcium in the blood when our body needs normal level of the calcium in our blood. Yeah, so and it is done by the osteoclasts. So this parathyroid hormone work on the osteoclasts. It like activates the osteoclasts, and as I have said, the osteoclast is responsible for bone breakdown, and it breaks down the bone, so it releases the calcium and phosphorus in the blood, and by it, like the normal blood calcium level in our blood is maintained. But what happens with the bone? Yeah, so the bone is like getting much more softer, because as I have said, the calcium and these minerals are responsible for normal and for the dense structure and the hard structure of the bone. And as the bone becomes much more softer because of the release of the minerals, yeah, it can lead some kind of fractures and etc. So that's why we need to maintain a normal blood calcium level in order to avoid like the pathological fractures, yeah, in order to not let our body to break down our bone, in order to supply other organs with the calcium. So is it clear about the structure, or you have like any questions about it, about the osteoblasts and osteoclasts, and about the yeah, okay, it's clear. Very good. Yep. Now let's make it bigger. Yeah, as you have said. So what the hell? So yeah, structure of long bone. Sorry, the structure of long bone. Let's review the structure of the long bone. As I have said, we have like the compact bone over here. As you can see, this bone is very compact with each other, and it's called the compact bone from the outside, as it begins with the compact bone, and on the inside we have like this spongy bone. So it's called the spongy bone because it has like its structure looks like the sponge. Yeah, and this spongy bone contains the red bone marrow. So that bone marrow is responsible for blood formation. Yeah, so not only formation of the erythrocyte, so is responsible for formation of every blood cell in our body. So white blood cells, platelets, and erythrocytes. Yeah. So also we have like here we have like the periosteum, and in the periosteum these cells, as I have said, the osteoblasts and osteoclasts are located. And for example, when you have like the damage in the bone and the periosteum is damaged, that will worsen the situation with the healing of the bone, because the more periosteum is damaged, that means that the more osteoblasts, or the cells which are responsible for bone formation, will be damaged, and that will be a problem in order to heal the bone much more faster. Yeah. So, and also we have here, as you can see, here is the much more bigger picture of it. We have like the medullary cavity. It's called the medullary cavity. Yeah, in the middle of the long bone, it's like the femur over here. Yeah, and it's like the medullary cavity, and in this medullary cavity, the yellow bone marrow is located. So the yellow bone marrow is like the deposition of the fats and different kind of minerals which we have inside of the bone. Yeah, and For example, when we have like the fracture of the bone in our body, the one of the main and one of the very hard and tough and very bad complications of the fracture is like the fat embolism. It's called like the fat embolia, yeah. And fat embolism, if you remember, we have reviewed the thromboembolism, thromboembolia, and the thromboembolia of the pulmonary arteries, yeah, and the pulmonary veins. So when we have like the thrombus in our blood vessel, and the one part of this thrombus is like separated from the bigger thrombus, and it travels through the bloodstream, and it can somewhere it can like make the compression of the blood vessel. Yeah, it can occlude the blood vessel, not the compression, and it can lead to the ischemia and the necrosis. Yeah, so the main thing happens with the fat, but in this case, main thing happened with the fat embolus. But in this case, the emboli is not a part of the thrombus, but it's part of the fat. Yeah, and why do we say that it's like the very important, and it's one of the main complications of the fracture, the fat embolus, because the bone contains the long bone in the medullary cavity contains yellow bone marrow, and this yellow bone marrow is the like the deposition of the fat. So the accumulation is made of the mainly from the fat, and when there is a big fracture of the bone, there is a probability that the one part of this yellow bone marrow, so the fat can enter the bloodstream, and it can travel through bloodstream, and it can occlude any kind of the, for example, the coronary arteries, and that can lead to the death, yeah, of a person, the myocardial infarction, and the death of a person. So be aware of it, and remember this, that we have like the yellow bone marrow in the medullary cavity, and this yellow bone marrow can be responsible for the patient death by causing the fat embolism. Yeah, it's not written in your books, it's like the general information for you. So is it clear about structure of long bone marrow and the yellow bone, bone and the yellow bone marrow and the fat embolism? Yeah, okay. So the fat embolism, remember, it's like very important theme and important thing about it. Okay. Sorry. Come on. Okay. Now, so we have like the joints here. I'm not familiar with this laptop. It's not mine, and that's why okay. So the joints, yeah, as I have said, and as I have mentioned, we have like the 206 bones in our body, and these bones are linked with each other, and the link of the bones is called the joints. Yeah, so when they are joined with each other, and they make they connect with each other, it's called the joints. Yeah, so what are the functions of the joints? So we have like different joint classifications. So for example, the joint classification, whether it whether it can move free or not. So we have like the joints with that allow free movement. For example, the diarthrosis, they are called the diarthrosis. Those that are fixed synarthrosis, and those that permit limited movement are ampiarthrosis. Yeah. So for example, we have like the diarthrosis we have in our joints of in the upper limb and lower limb, yeah. So we can allow the free movement with our hands and feet, and etc. etc. We have also the fixed joints and the joints that permit limited movement. So also, for example, the joints in the pubic symphysis is like the ampiarthrosis because it permits the movement, yeah, and etc. And also we have like the different joints by the classified by its structure. Yeah, we have the synostotic, cartilaginous, fibrous, and synovial. Now we will review like the synovial joints, yeah, because the synovial joints are like the are most common in our body, and the synovial joints also are the most common cause. So this and the main diseases associated with the musculoskeletal system and the joint diseases are linked with the synovial joint. So what is the synovial joint? The synovial joint is like the joint of two bones. These two bones are ending with the articular cartilage. So as you can see, it's like the cartilage, articular cartilage. It's called the articular cartilage. So, and with this articular cartilage, the two bones are joined with each other. Yeah, and they form like this is called the joint, synovial joint. Yeah, in this inside of the synovial joint, we have like the joint cavity or the synovial fluid. Yeah, synovial fluid, and also this joint is supported by the ligaments. Over here, you can see the ligaments and tendons. Yeah, so the joint which is made by the two bones for ending with the articular cartilage, joining each other with the articular cartilage, and this joint is supported by the ligaments and also by the capsule, and inside the capsule it contains like the synovial fluid. It's called the synovial joint. Yeah, for example, our knee joint. Knee is one of the main most important joints in our body, because the knees there is like a lot of load on our knees during our lifetime, and they a lot of joint diseases, such as, for example, such as arthritis. Yeah, so the rheumatoid arthritis. Yeah, and etc. etc. They occur in the knee joint. Yeah, and the knee joint is the synovial joint, and you have to remember that the knee is supported by the ligaments. For example, we have also, if you are watching the sports, for example. Yeah, and especially if you watch the basketball, yeah, for example, that is like where the common trauma in the basketball, which is called the tendon of the ligament, so the ACL in sportsman's knee, for example. So, are you familiar with do you watch basketball? Sadly, no. Yeah. So if you in the other sports, but especially in the basketball, for example, the ACL, so it's like the cricoid ligament. It's one of the ligaments in our knee. Yeah, and this ligament support and make sure that the knee works in a knee does not bend more than it should bend. Yeah, so and in this case, when there is a lot of load on the knees, yeah, especially in the sportsmen, especially in the basketball players, because they are like the sprinting, then they are they are sprinting, yeah, very fast, and etc. etc. And it in this case, this ligament can be teared, yeah, and it leads to the very bad trauma, yeah. So this synovial joint at the knee, because of the lot of load on we have a lot of load on our knees, because the mass, for example, when people is obese and all this mass and everything is gets the load on the knee, and you have to remember that the knee is like the synovial joint. It is made of the two bones ending with the articular cartilage. Inside they have like the synovial fluid, yeah, and synovial fluid, and all this is supported by the different type of ligaments. Yeah, so as I have said, the musculoskeletal system contains of the bones, joints, muscles, yeah, and the nerves also. Yeah, and we have like the when we talk about the muscles, we have talked about a lot about the muscles, but now I want you to pay attention to the working process of the muscles. So we have like the neuromuscular junction, yeah. Every muscle flexes or relaxes according to the nervous stimuli, yeah, and as soon as the nervous stimuli by the motor neurons from the spinal cord comes to our muscles, that means that this muscle have an ability to contract or to relax, yeah. So, and this is done by the neuromuscular junction. So as you can see here, this is like the neuromuscular junction. It's very important substance, it's very important structure in our body, yeah, and I want you to pay attention to it. So it's made by the motor neuron axon. This motor neuron axon ends with that kind of the junction, and it makes the junction in the to the muscle, yeah, and at the end of this motor neuron axon, we have like the synaptic vesicles, and these synaptic vesicles contain the different neurotransmitters. In the case of the neuromuscular junction, the main neurotransmitter is acetylcholine, yeah. So the acetylcholine is like the responsible for So for the nervous stimuli, comes from the nerves and goes to the muscle and enables and leads the muscle to contract or to relax. Yeah. So this is the thing you have to remember about it. Yeah. And the neuromuscular junction, there are like a lot of neuromuscular junctions, and almost every fiber has its own nerve supply. Yeah. And these muscles work in the antagonistic way. So, for example, if I want to bend my knee or if I want to flex my arm, that means that I have like the two types of muscles. First muscle is responsible for flexing my arm, and the second one is responsible for flexing my arm. And that means that when I want to flex my arm, that means that the flexing muscles are flexed and the antagonistic muscles are relaxed at that time. Yeah, and that lets my body, and that's called the antagonistic work. Yeah. So as soon as we have like the nerval stimuli, which comes at the end of the motor neuron axon, this motor neuron axon has an ability to release the acetylcholine, which is saved in the synaptic vesicles. The acetylcholine we have our muscles. We have like the channels, and then we have like the receptors of the acetylcholine. And as the acetylcholine receptors are, so as the acetylcholine acts on the acetylcholine receptor, that means that it opens the channels for the sodium ions, and the sodium ions enter the muscle, and the impulse is generated, and the flexion of the muscle happens. So remember the neuromuscular junction. Remember that the main structural element responsible for our muscles contraction is the neuromuscular junction. It's made of the motor neuron axon and the muscle fiber. Yeah. And these motor neuron axons come from the spinal cord, and they are responsible. They release the different neurotransmitters, and in the case of the motor neuron axons, they release the acetylcholine. The acetylcholine then act on the acetylcholine receptor and causes the further impulse travel into the muscle and causes the muscle to contract. So this was the thing I wanted to tell you about the normal anatomy and physiology of the musculoskeletal system. So do you have any questions about it? So I guess that I'm talking too quickly, yeah, or not? So or it's normal, or should I slow down a little bit? Okay, so you can understand it. Okay, very well. Let's go further. I want this slide over here. Sorry. Yeah. So let's go to further and let's move on. Now I want to talk about assessing the patient with a musculoskeletal disorder. Yeah. So what are the main complaints of a patient with a musculoskeletal disorder? So some kind, any disorder. So in your opinion, what can the main complaint be of a patient who suffers from the musculoskeletal disorders? It's like the question for you. What is the main complaint of a person who suffers from the musculoskeletal disorder? Any kind of disorder, not saying like the one fracture or osteoarthritis or anything. Yeah, pain. That's right. Pain. Yeah, that's right. So very well. That's a good question. The main symptom, pain, lack of movement, immobility, or the immobility, lack of movement is the same as the immobility. So fatigue. Okay. Well, so you are like the you understand this, yeah, and you understand the subject. Good for you. Yeah. This is the thing, yeah. And when a person suffers from the neuromuscular any kind of disorder, the main thing and the main symptom is the pain. It's very clear. Also, the lack of movement, because the muscles and the skeleton is responsible for movement, and it's like very logical. And also, as you have said, the fatigue, it can be also a fatigue, but the main things are like the pain and the lack of movement. So the pain and the mobility. We talk about assessing the patient with a musculoskeletal disorder. That means that we have to assess like the pain. So we have to assess and we have to ask about the symptoms and the complaints, and the main complaint is the pain, and how we can assess the pain of a musculoskeletal disorder. So it's called like the PQRST system. It's like the easy, in order to remember much easier. So PQRST. That means that the provocating and precipitating factors. So we have to ask our patient what makes your pain worse and what makes your pain better. So what makes pain of our patient worse and what makes it better. For example, there can be some kind of poses and in some kind of posture in which the pain just goes away or is decreased, in severity, and in the opposite way also can be possible. And we have to understand and we have to ask that kind of questions, because that can help us to determine what kind of illness we have, not we, but what kind of illness our patient had. Also, the quality of the pain. So what does your pain feel like? How would you describe it? So like the interpretation of the pain. So how patient interprets it. It can be a burning pain, acute pain, dull pain, etc., etc. So there are like the different words and different explanation of the pain and the quality of the pain. So Q, also the R, the radiation. Does the pain move anywhere? So radiation is a very important one. So for example, when we talk about the radiative pain which radiates somewhere, the first thing we think about it is like the lower back pain. For example, when we have like lower back pain and this pain is that radiates in the lower limb, that's called the radiculitic pain, and this is the radiation. So the pain move anywhere. We have to also ask about it. This severity of the pain. It's like the very popular and very famous method to ask our patients. So about the scale of the pain. So how, for example, we can ask how much does your pain hurt right now? And we have to give them like the choice, and it's best and it's worst on the scale. So the scale is like from 0 to the 10. And how would you describe your pain according to the scale? In some cases, maybe some patients who suffer from a very acute and very severe pain, they can say that it's like the 10, or maybe in some cases not 10, 100 or something like this. But in this case, we have to pay attention to the psychological condition of a patient. So the people differ from each other. That means that for example, the one patient with the same pain can say that it's like only 5 or something like this, and the other person who is more emotional and who cannot deal with the pain, and they have like the lower limit of the pain, they can say that it's like a very severe pain. So we have to pay attention when we assess the severity of the pain to the emotional condition and the psychological condition of the patient. It's very important one, in order to understand it much better and to understand it correctly and to assess it correctly. And also the timing. What's the 24-hour pattern of your pain? So for example, in the last 24 hours, how was the pain, how pain changed itself? For example, it increased, decreased, so it has like the periods of increase, periods where it increases or decreases, and etc. So we have to understand also this. So remember the PQRST system, and not only for like the exams and etc. You have to remember this just simply for your career and for your future work, because you will have to deal with a patient who is suffering from pain almost every day. And remember the PQRST. It can be in this by this system can be assessed not the pain of a patient with a musculoskeletal disorder, but any pain. So, and also we have like the different kind of pain in our for our patients. So, for example, in neurogenic pain, it can be characterized as the sharp stabbing, shooting, burning, pins and needles, numbness pain. It's caused by the neurological nature relating to either motor or sensory nerves, and also in the case of there is the imaginary nerve reverse, the neurogenic pain can occur. Also, the articular pain, pain that alters with movement, weight bearing, and maybe the leaf that and those stiffness with that can be swollen, likely to be associated with damage to articular structures. So when we have like the imaginary articular structures and we like rest these articular structures, that means that patient won't feel the pain, and as they move more and they load these articular structures, the pain will increase. It's like the also the phantom pain. If you have listened to my lecture, and my last lecture was about the pain in general, and I have said that there can be the phantom limb pain, for example, pain that is felt in a limb that is not present, after the amputation, for example, of congenital limb deficiency, nerve avulsion, spinal cord injury. In this case, when we have like there is no pain, there is no limb, and the patient feels the pain in this limb. So in the absent limb, it's called the phantom pain. Remember this. I have said it has like mainly it can have like the two causes, because one cause is like during the amputation, the nerve fibers are also damaged, and that can lead to the pain. And also the second thing is we have like the receptors which are responsible for giving to our brain information about the shape of our body. And in this case, the receptors may be giving the information to our brain that the limb still is present, and there was no amputation. And if the brain has that kind of information, that can lead to the pain in this limb also. So it's like the two possible causes. It's like the topic of our last lecture. If you listened to it and if you remember. Also, the inflammatory pain, the multiple painful joints, often symmetrical, morning stiffness, but improves with exercise, swelling or erythema. And the morning stiffness is like the pathognomic symptom of the rheumatoid arthritis. Claudication, cramping pain felt when walking, often relieved by rest, may mean there is an arterial insufficiency. The claudication, the pain, that kind of pain can be caused by the arterial insufficiency when there is some kind of ischemia during the when there is the increased load and increased demand of the blood flow, and the blood flow is not adequate, and blood flow cannot reach the demand of the blood of it, and that means that can lead to ischemic pain, and it's called the claudication. So any questions about the assessment? Any questions about the assessment? No. Okay, so let's go. Let's move on. Let's go to the very, very important and very actual problem in today's world, and not in today's world, but in general. Let's review now. Sorry. That's some kind of problem. Okay, the fracture of the bone. No, I don't think that's like the fracture of the bone. The fracture of the bone is like it's like the fracture of the bone, where the important thing can be fracturing of the bone is where the actual thing, especially when there is the weaker on our slits. So there it can be the IC outside, and it is linked with the fracture of the bone, and the traumatologists and orthopedics are like Dino. Sorry, they're like the noisy person in my working place. Sorry. Okay, so the fracture of the bone. We have like different kind of fractures. It can be a transverse fracture, which here when there is the fracture transverse, linear fracture, oblique one, not displaced, oblique but displaced when the two pieces of the bone are like displaced from each other. The spiral fracture, also the comminuted fractures when in the fractured region there is like the small pieces of the bone. So the fractured region is area is fractured inside also. Yeah, it's like very it's like very common and very complicated fracture when we talk about the comminuted fracture. So what is the fracture in general? Fracture is like the losing the continuous of the bone. So the bone is not continuous and is not full in the case of the fracture. And there it can be caused by the different different injuries and damage. For example, when there's the direct or indirect injury. So when there is like the direct injury, it can cause also the fracture. When there is the indirect injury, it can cause the fracture. But when there is, for example, there is no injury at all and the bone is fractured by itself, that is called like the pathological fracture. And the pathological fracture is always linked with the other conditions, so with other bad and very complicated conditions. For example, the lymphoma or the cancerous diseases. Then there is some kind of metastasis in the bones, and the bone is very it's getting softer. For example, when we talk about the osteoporosis, yeah, and the bone is getting softer. In this case, the pathological fracture can happen. That means that there is no damage at all, and the fracture can occur during the rest time, for example. Yeah, so remember the thing about the pathological fracture. So as the now let's review the what kind of things happen when we talk about the fracture histologically. So in in details there. And within the first 6 hours, as a result of the blood vessels and the bone becoming ruptured, the hematoma forms. The forming of the hematoma is very important when we talk about the fracture. Yeah. From 6 to 48 hours, the inflammatory process begins and the cytokines are released. This causes fibroblasts to migrate to the hematoma and tissue granulation begins. Yeah. So as you remember, the inflammation, when there is some kind of irritation, it can be bacterial and not bacterial, any kind of irritation, they are in a specific response to that kind of irritation is the inflammation. Yeah, and in the case of the fracture, the inflammation occurs. Yeah? So all the symptoms of the inflammation, such as the pain, such as edema, such as swelling, yeah, redness, the temperature, and the loss of the function. So all these 5 symptoms will be so we will so okay, so we will see all this that kind of inflammatory changes in the bone, and the symptoms can be like when you assess for example, fractured bone or the fractured limb, you can see that the redness, swelling, temperature, and the loss of function, and the pain, yeah, especially pain. Only 2 to 7 days as the granulation tissue begins to form, it becomes denser and more stable and with the infiltrating cartilage tissue. Yeah, matter of fact, begin to work hematoma and osteoclast, they absorb the damaged bone. So as you can remember, the osteoclast and osteoblasts, the osteoclast absorb the damaged bone. Also, the weak callus formation occurs. That is where the structure surrounding the fracture area becomes hard. This hardened bone is eventually molded and becomes lamellar bone, and the callus over time becomes smaller and the bone is reconstructed. So when we talk about the fracture, during the fracture, like this process occurs by itself. Yeah, so this process occurs, the process of inflammation and the process of the bone healing. Yeah, bone healing process is very important one. In the bone healing process, the periosteum has a huge role. So in the periosteum, as you remember, I have said that the osteoblast and the osteoclast are located in the periosteum, and the more periosteum is damaged, the much more harder and tougher will be to heal this fractured bone. Yeah, so the osteoclasts are like responsible for bone formation. Yeah, at first the granular tissue is formed, then this granular tissue is getting more denser and denser in order by accumulating of the calcium and the collagen matrix. Yeah, and etc. And the osteoclasts are also responsible. They remodel the bone, so they are responsible for breaking down the old bone or the fractured bone. Yeah, and the new bone is formed. The bone is healed. But in this case, in a lot of cases, yeah, maybe this processes to be occurred, patient has to be immobulated. So the patient's that bone and that joint and that muscles which are fractured, so that bone which is fractured must be immobulated. So that means that we are giving we don't have to move that. Well, for example, when you have a fracture on the femur, that means that you will be able to move and move your leg, yeah, so move your limb, yeah, and that means that in this case it's very important in order to heal the bone, but it can be also associated with a different kind of complications. So here are the complications associated with the immobility, and as you, as a healthcare professional, you have to always remember that when your person is immobulated and when your patient is immobulated due to the fracture, yeah, so he or she fractured his or her leg, and then he or she is immobulated at the hospital, you have to always remember that kind of complications can occur. So the first and foremost is like the deep vein thrombosis. When there is immobilization, so there's no muscle movement, and as you remember, the muscle movement is like the obligatory thing in order to provide the normal blood flow from the veins. And if the muscles are not moving, so that means that the pumping effect of the muscles won't work, and if the pumping effect of the muscle won't work, that means that the blood will be like pooled in the veins, and the pooling of the blood in the vein, especially in the deep veins, that can lead to the deep vein thrombosis. Yeah, it's like the simple. If the deep vein thrombosis occurs, there is a very high probability that the deep vein thrombosis can lead to the thromboembolia and the pulmonary embolism. Yeah, and the pulmonary embolism can lead to the death. Yeah, even to the death. Yeah, and to other complications. Also, the increased cardiac workload, orthostatic hypertension, decreased cardiac output, and reduced tissue perfusion because of the pooling of the blood in the veins that leads to the decreased cardiac output because of the decreased preload of the heart, that leads to the decreased output and reduced tissue perfusion and tissue hypoxia, chest infections, renal stones. This is all associated with immobility. When there is no, the renal stones can also occur. Incontinence, muscle wasting. Yeah, when you don't lose your muscle for a long period of time, this muscle is atrophied. Yeah, and atrophy of the muscle occurs, and the same thing happens with when there is a fracture when there's a fracture and patient has a fracture. Also, the joint contractures. Joint contractures are part of the process when the joints are joints are losing their main function, so they cannot move and they cannot be mobile because they have been immobilized for a long period of time. Also, the frustration, boredom, and isolation, and loss of self-esteem. These are like the psychological complications and the complications associated with immobility. So remember these complications. These are very important one, and remember when you will be dealing with a patient with a fracture. Yeah, it's like the very important thing. Let's go further and move on, and let's talk about the osteoarthritis. So I think that the fracture is like. Is it clear? Any questions about the fracture? Maybe. So just any kind of questions about the fracture? Okay, I haven't. Oh, I have seen your chat right now. So how is this? Has it fixed? So my connection is normal, but so we haven't heard anything about the fracture. So uh, so can you hear my voice now, or it's breaking down again? So my connection, it's breaking down, or it's coming okay. It's okay. So you can hear it very clear, or it's breaking. Mm-hmm. So okay, if there is some kind of, if this problem occurs again, so please let me know, and I will try to connect with the phone. It will be much better, or something. Fracture complications. Then now let's talk about the osteoarthritis. Yeah, the osteoarthritis is the disease which is associated with the damage of the cartilage and the cartilage loss throughout the years. Yeah, so it can be associated with a different. So there's the one causative factor is not known, unfortunately, about the osteoarthritis, as you can see from this picture. So here is like the normal articular cartilage. Here is the normal articular cartilage, and when there's the cartilage loss or cartilage damage, that causes the osteoarthritis, and that leads to the narrowing of the joint spaces. Yeah, and also the bone spurs are formed. The bone spurs are called the osteophytes, and the formation of the osteophytes and narrowing of the joint space is like the pathognomical symptoms and pathognomical signs of the osteoarthritis. Yeah. So when there is, for example, when there is any kind of cartilage loss, the joint spaces are narrowed on the X-ray. Yeah, and we have like the osteophytes. So the bone spurs, the bones have like the spurs over here, as you can see from this image. It is called the osteoarthritis. Yeah, it can be caused by the different factors, but there is not the main causative factor is not unknown, unfortunately, and we know the risk factors which are associated with the osteoarthritis. So how is my voice now? Good. Okay. So the mechanism of the osteoarthritis is that there is the damage and the loss in the cartilage, and that leads to the narrowing, joint space narrowing, bone spurs, and it like the worsens the joint function. So the joints are not able to work properly, so they are not able to bend. For example, if you have the osteoarthritis in your knee, here is the example of the knee. Yeah, that means that the knee won't be able to, the knee won't be able to, and the knee joint won't be able to have its unique and its main function. So to provide like the movement. Yeah. And that will lead to the cartilage low, and that leads to the pain because of the bone spurs. There is like as they spars in the bone, and this bone spurs also they irritate the nerve endings, and that leads to the pain. Yeah, and this means that the osteoarthritis is also always associated with the pain during the walking. So and the cartilage pain. Yeah, and if when a person has the complaints of the pain, the cartilage pain, so the pain which occurs during the walking. Yeah, and you take the X-ray, and on this X-ray you see that there is the narrowing of the joint spaces, the cartilage is lost, and the cartilage is damaged, and also we have like the bone spurs. That means that our patient suffers from the osteoarthritis. So what are the risk factors of the osteoarthritis? Age 45 years and over. So aged people are more, they have like the increased risk to have osteoarthritis. Also, the gender, the more common is in females. So the females suffer from the osteoarthritis more than the males. They also the genetic predisposition. That means that if your if a patient's mother or father suffers from the osteoarthritis, he or she has like the increased risk factor of developing the osteoarthritis. Also, the overweight and obesity. Yeah, overweight and obesity is like the important thing when we talk about the musculoskeletal system, and you will see that the almost every disease and obesity, overweight and obesity is like the risk factor for almost every disease associated with the musculoskeletal system. Yeah, because when we have the overweight and our patient is obese, that means that there's more load on the musculoskeletal systems, and the probability that the damage, that some kind of damage will occur, is much higher than the normal weighted persons. Yeah. Also, the some occupations and previous injuries. Yeah, if you had some kind of injury with your catalog, yeah, that means that you have like the increased risk developing the osteoarthritis. So how is the voice? Just one more time to check it. So you had osteoarthritis without voice breaking. Yeah, okay. Okay, so these factors and the care and management. So as a healthcare professional, you have to know how to care and how to manage the patient, how to care about the patient with osteoarthritis, and how to manage patient with osteoarthritis. That means that the first and foremost thing is to reduce the pain, as you have already mentioned and answered me. Yeah, the main complaint associated with the musculoskeletal system is the pain. Yeah. Also, we have to advise our patient to increase mobility and independence, but this mobility and independence should be like not a very hard load on our joints in order to cause the pain, but just for example, walking, jogging, if it's possible, and etc. Swimming is also very well recommended in this case. Also, the minimized progression of the disease. This is like the our main goal as a healthcare professionals and as doctors. Yeah, also the exercises, and these exercises, which are by which they can be these exercises should be tolerated. The patient should be tolerated with these exercises, and the weight loss. Yeah, so the weight loss is like the first and foremost recommendation when we have the obese or overweighted patient, because they less weight will provide the less load on our joints or our bones. Yeah, and that will improve our condition, and that will improve the condition of the patient. Yeah. So this was the thing about the osteoarthritis. Any questions? Any questions, please? No. So everything is clear for you. Good for you. Okay. The next one is called osteoporosis. Yeah. So as you can see from this picture, as you can see from this picture, the osteoporosis is like the decrease in the density of the bone. Yeah. As you can see here, this first bone is like it has like the normal density. Yeah. It has here compact bone, the sponge bone, and the density of the sponge bone is normal. Yeah. So in the picture, it's sorry, the phone is calling. Sorry. Hello. One second. Oh, sorry for interruption. Yeah. Okay. So here, as you can see here, the density of the bone is decreased, but in this case, the density of the bone is decreased much more, and on the last picture, there is no density at all. So as you can see, these holes in the bone are much more bigger inside, and at least that the bone in this and the bone tissue in these holes there are no bone tissue in this holes, and means that so the osteoporosis is like the increase in the bone density. Yeah, it's also called the Nikoloz bone. Yeah, and the decrease decrease in the bone density that can be associated with different kind of conditions. Different these factors can be during the osteoporosis. So in normal cases, when people ages and by the as the people are aging and is getting older and older, the osteoporosis occurs. So that means that the density in the bone is decreased, and the bone density is decreased, and the bone is getting much more softer, and the bone is like the softer bone it's much easier for the bone to be fractured. Yeah, so to occur the pathological bone. So the, for example, on this last picture, if a person has that kind of bone, that can it's a very high probability that that kind of bone can be fractured during the rest time, even during the rest time, because the bone density is decreased. So the bone density is very, very decreased. Yeah. What are the risk factors? As I have said, in normal, for example, when I get older, yeah, I will have like the osteoporosis, but this osteoporosis will be normal for my age. Yeah, that means that it's not disease. It's like the normal for your age. Yeah, so that kind of density is normal for age. Yeah, and because the absorption of the calcium is decreased, and all the physiological changes which occurs by the age, that means that this will all cause like the osteoporosis. But there are like the risk factors which will lead not to the normal and the physiological osteoporosis, but that can lead to the osteoporosis as a disease. Yeah. So the advancing age, as I have said, the risk of osteoporosis and fractures increases in women 65 years and over, and men 75 years and over. Yeah. So why the osteoporosis is very dangerous thing? So what if why it's important? Yeah. Why can person have like the low density bone? Yeah, and there is no problem at all, because it's problem because the osteoporosis as itself is not problem, but the complication of the osteoporosis is the bone fracture. Yeah, and the bone fracture and the poor bone healing because of the poor calcium, and because of the poor calcium absorption and poor calcium level in our body, for example. Yeah, and that means that the osteoporosis can lead to the fractures, and these fractures can lead to the immobility, and this immobility can lead to the lot of other risks, of other complications which we have discussed already. Yeah. So the advancing age, as I have said, the sex hormone deficiency. Yeah, female are female have like the higher risk of developing the osteoporosis because the sex hormones after the menopause, there is like the decrease in the sex hormones. So the estrogen and progesterone, and the estrogen and progesterone are responsible for providing and for maintaining the bone density, high density, and when as we have the decrease in the sex hormones, that will lead to the decrease of the density of the bone and to the osteoporosis and maybe the fractures. Also, low body mass index, less than 80.5 kilogram per square meter. Medications, also frequent or current use of glucocorticosteroids, chronic diseases such as the chronic liver disease, inflammatory bowel, or celiac disease. This chronic liver, inflammatory bowel, and celiac disease are all linked to the poor absorption of the calcium. So, for example, when you have the inflammatory bowel and the bowel is inflamed and the mucus of the bone is inflamed, that means that the bowel will have like the less ability to absorb the calcium, and the less calcium we have in our blood and in our body, that will lead to a lower density of our bones. Yeah, because the density is mainly maintained by the so this that will lead to the like yeah, so that will lead to the decreased bone density. Yeah, because the bone density is maintained, and the bone density and the responsibility for bone density has the calcium, magnesium, and phosphorus, but mainly the calcium. Also, the previous fragility fracture, premature menopause, family history of maternal hip fracture, immobility, smoking, excess alcohol, more than 14 units per week for women and 21 units per week for men. For me, no, not for me. I have written here for me. For men. Okay. So how how can this osteoporosis be diagnosed? So what can we make in order to make the diagnosis of the osteoporosis and say that there is like this patient, this particular patient has the osteoporosis? So we have to assess the level of the serum calcium, albumin, and phosphate. Yeah, because if we have a decreased calcium, that means that we will have like the decreased density, serum creatinine, serum thyroid stimulating hormone. As we have said, the TSH, thyroid stimulating hormone, plays a huge role in thyroid inactivity of the thyroid and parathyroid hormones, the alkaline phosphatase and the transaminases. And the last but not least, and like the gold standard for diagnosing the osteoporosis is the dual energy X-ray absorptiometry. It's also it's like the X-ray machine, which is responsible for detecting the density of the bone. So we know the normal range of the density of the bone, and by the help of this X-ray, we can find out the if persons if this person has the decreased density bone density or not. So this is like the gold standard of diagnosis with dual energy X-ray absorptiometry. Okay, so what about the care and management? Regular weight bearing exercises in order to decrease the load on the soft bone. So when the bone is softer, that means that it cannot be tolerated with the high load, and when we lose our weight, that means that the load will be decreased, and that will help our patient to maintain and help our patient to avoid some kind of pathological fractions. Yeah, so the adequate nutrition, eating foods that are rich in calcium and vitamin D. The vitamin D is a very important one because the vitamin D is responsible for absorption of the calcium. So without vitamin D, if you eat the calcium and you have like the low level of the vitamin D, that means that this calcium will not be absorbed normally and adequately. Also, the avoiding of smoking and avoiding of excessive alcohol intake. The next one over here, the next one is like the low back pain. So the low back pain, any questions about the osteoporosis? So how was the voice? Is there this problem is persistent or gone? Degeneration of the bone. Yes. Osteoporosis, yeah, definitely. The fact kids, so they have like the processes also which are inherited osteoporosis. So the kids which are like if osteoporosis occurred also in kids, for example, that's why we are giving to kids like the vitamin D from the birth, from the second week of the birth, in order to maintain the normal calcium absorption, in order to avoid like the osteoporosis. Yeah, because this osteoporosis and it's like much more complaints it has in the kids, because as when we talk about the elders, that means that it can be complicated by only the fracture. But when we talk about the kid, it can affect the normal development of the kid, and the kid may become has the short stature because of it. So it cannot. It can affect like the development and physical development of a patient and of a kid, and it's very important one. We have to provide our patient with adequate vitamin D, and also we have to provide with adequate nutrients in order to maintain the normal calcium level. Yeah. So it's like very important ones. It's a very good question. Yeah, it affects kids definitely, and we have to pay attention to the kids if there are some kind of some kind of signs of osteoporosis. We have to pay attention to it. So we have to give them the vitamin D, because, for example, the vitamin D is synthesized by the the vitamin D synthesized by the help of the ultraviolet so the ultraviolet, and that can lead and in the countries when there is no sun at all, for example in the north countries, and this can be very it can lead to the rachitis. Yeah, you have heard about that kind of condition. For example, it's called the rachitis, and this rachitis is a condition which is which occurs because of the low level of the vitamin D. The low level of the vitamin leads to the low level of the calcium, and the low level of the calcium leads to the rachitis. So there is no normal formation of rebone. Yeah, because the kid is developing, and the kid needs the more nutrients because it has like the more demand on the nutrients. We have to give them the adequate calcium. So the adequate calcium intake should be maintained in order to avoid that kind of complications. So in order to avoid the rachitis and in order to avoid the osteoporosis. Yeah, so that's a good question. Yeah, it affects kids definitely, and we have to be very attentive with that. Okay, any other questions? Okay, may I continue now? Care and management. So the low back pain. Low back pain. The low back pain is very common condition for patients. So it has more probability to it has like the more probability to be occurred in the higher ages, but in, for example, the person who are like from 30 to 30 years old. The 30 years old is not an old person. They also are suffering from a low back pain, and this low back pain can be non-specific low back pain, and can be seen as a tension, soreness, and those stiffness in the lower back area without a specific cause of a pain. So the low back pain can be very dangerous. So it can be caused by this dangerous disease, and it can also be just like it cannot be, there can be no specific cause of pain. So there can be the tension, soreness, stiffness in the lower back pain, but without a specific cause of pain. The several structures in the surrounding area may contribute to the pain. So they include the joints, muscles, ligaments, discs, and connective tissues. Yeah. For example, when we have like there is like soreness in the muscles, and these muscles, for example, the muscles of our leg can be very weak, and when there is the increased load on these muscles, they can be like they can cause the pain, and it can be interpreted as a low back pain, and it can be caused by the muscle weakness, also the ligament tension, or also the discs and connective tissues. Yeah, and also there is some low back pain can be accompanied by radicular pain. So radicular pain, which is defined as pain radiation into the lower limb along the course of a spinal nerve root. So it's called the radicular pain, and the radicular pain is much more serious. So there can be like the compression of the nerve, and compression of the nerve in the spinal cord, so in the vertebra, and this compression can be happen. So there can the nerve can be compressed by the discs. Yeah, so the discs of the vertebra, and it can be a serious condition, and also there can be the herniation and the hernia of the vertebra, and it's so there it can be caused by the sorry. Uh, So as you can see, this low back pain can be a very serious condition caused by the, for example, compression of the nerve between the discs. Yeah, also the compression of the nerve of the spinal nerve, and it can cause the radicular pain. But it can also be the non-specific low back pain that can be seen as a tension, soreness, or stiffness in the lower back area without a specific cause of pain, and with several structures in the surrounding areas. So, for example, the muscles, joints, ligaments can contribute to this pain. Yeah. So, what are the risk factors of the low back pain? As you can see, the age from 35 and 55 years, between sedentary lifestyle, obesity, also poor postures when you have to work, for example, in very bad and poor postures, and you have to sit for a long time, it's very bad for the low. So it's very bad for the low back muscles, because when you are sitting, these muscles are always relaxed, and as the muscle is always relaxed, it's getting it is atrophied, and it's getting weaker and weaker. And when you have to move more and you have to stand for a long time, that can lead to the pain in your lower back. Yeah, also the arthritis, osteoporosis, lack of exercises. You have to exercise your back muscles in order to avoid the low back pain, because the stronger back muscles you have, that can avoid you, and that can help you to fight with the low back pain and also the occupation. Yeah. What about the care and management? So the care is like the exercise programs. So the exercise programs, noisy people. Exercise programs. Exercise should consist of aerobic activity, muscle strengthening, postural control, stretching, and movement instruction. Also, the manual therapy and acupuncture can be also helpful when we deal with a non-specific low back pain. So when we have like the specific low back pain, and we know the causative factor of the low back pain, it can be the herniation of the spinal cord, or it can be herniation. It can be like the compression of the nerve between the discs or something like this. In this case, maybe the surgery must be made. But when we talk about non-specific low back pain, the acupuncture, manual therapy, exercise programs, and can help us. Yeah. And also, I want you to pay attention to it when, as a healthcare professional, and the doctors and the people who work in the hospitals, they have like the increased. Here is not written risk factors, but in my opinion, they have the increased risk of maintaining the low back pain, because you in the surgery room, for example, in intensive care units, and etc. and etc. There are a lot of cases and a lot of things when you have to be in the poor posture. For example, during the surgery, you have to stand for like the 10 hours in some kind of specific surgeries, or in the intensive care unit. You have, when during the intubation, you can be in the poor posture for a long time, or during the different manipulations, and etc. and etc. And there are a lot of persons from the medical field, so a lot of persons from the medicine, they suffer from lower back pain, and they are always complaining about it because of the poor postures and because of the increased load on their low back muscles. Yeah, so remember this. And now we have to review like the last but not least disease, which is very important. And so, any questions? No questions. Okay, so let's go to the last, our like last but not least. So it's called the gout. Gout is like the disease which is associated with the accumulation of the uric acid crystals and uric acid cells in the body and in the blood. The increased uric acid cells in the blood, and that leads to the accumulation of the uric crystals in the joints, and that leads to the inflammation. So it's like the crystal and uric acid crystal associated inflammation. So the arthritis, so inflammation of the joints by the accumulation, which is caused by the accumulation of the uric acid cells in the joints, and that leads to the irritation, inflammation, and the pain. Yeah. So let's review it much more in detail. So what is the uric acid? Yeah, uric acid is like the waste product, which is formed after breaking down of the cells. So when the cells are broken down, despite of nevertheless, and despite of which cell it is, yeah. So when it's broken down, it forms a lot of uric acids. Yeah, and the uric acid is like the waste product, and this uric acid is excreted from our body by the kidneys. Yeah, so we have like the two mechanisms how the uric acid can be increased in our body and in our lungs. blood level to that level that it can be accumulated in the joints, and that can lead to the inflammation and the disease called gout. So the first thing is that we have like the increased formation of uric acid. So for example, when we have like the increased digestion or increased breaking down of the cells, and that means that the more uric acid is produced. Yeah, so after the more uric acid is produced, and that means that the more uric acid is produced, the kidney isn't able to extract all of it, and all of it, and that leads to the increased blood level of uric acid. This uric acid is accumulated in the joints, so the loved location. So the uric acid love to locate in the first metatarsal. So in this joint, so the joint between the first metatarsal and metatarsal joint. Yeah, it's called like on our foot, on our first toe. First toe joint, and this uric acid is associated, is accumulated there. This accumulation of this uric acid in this joint leads to the irritation. Irritation leads to the inflammation, and the inflammation leads to the pain, redness, warmth, and losing edema, so the swelling and losing of the function of the joint. Yeah, so this is the gout. And the second mechanism of the gout is that when we have some kind of for example, the kidney failure, and the formation of the uric acid is normal, so it's not like the over formation of the uric acid, but the excretion. There is the problem with the excretion and the output of the uric acid. That means that we have some kind of problems with the kidneys, and that can lead to the gout also, because when the uric acid is not excreted from our body, that means that it will be increased in our blood level. That will lead to the accumulation of it in the joints. The accumulation will lead to the inflammation. Inflammation will lead to the pain, redness, warmth, swelling, and losing of function. Yeah, so this is the thing about the gout. What are the risk factors? So what are risk factors for the family history? It's like the genetical predisposition, obesity, excessive alcohol intake, because the alcohol after the digestion of the alcohol, the alcohol after the digestion of the alcohol, so the increased number of uric acid is formed, and that can lead to the gout also. The high protein diet, proteins are found in many foods, for example, meat and seafood, acute infections, use of diuretics, ketosis, surgery, leukemia. During the leukemia, because we have like the increased number of white blood cells, that leads to the white blood cells are formed in the increased number, and that also means that they are digested also in the increased number. The digestion will lead to the increased uric acid formation, and the increased uric acid formation can lead to the disease called gout. Cytotoxic drugs, hypertension, and renal failure is linked to the decreased excretion of the uric acid, and that leads to the gout also. So, and what are the care and management? First and foremost is like the pain management, also the lifestyle modification. That means that we have to educate our patients that we have to educate our patients that this disease is caused by the increased number of uric acid cells. So the uric acid cells, increased number of uric acid cells can be caused by the purine, increased purine diet, etc., etc. We have to help them to modify their lifestyle in order to avoid like the increased formation of uric acid, and also the lowering of urate levels. They are like the specific drugs. We are not going to review it now. You will remember it. You will study it later in pharmacology. So there are like two mechanisms of this drug. So the one of this mechanisms act on the kidneys, and these mechanisms are like the diuretics, but they are like increasing the excretion of uric acid, and by this we can lower the urate level. So this is the care management of it. Now, so this computer is lagging. This computer is like, I don't know. Okay, so from foods, hyperuricemia. Yeah, from foods, you are familiar familiar with almost every disease, so good for you. So from food, for example, when we eat the food which contains the high purines, for instance, meat, for example, contains the high purine that leads to the increased formation of the uric acid, so the hyperuricemia, the increased level of the uric acid in our body, in our blood, hyperuricemia, and hyperuricemia leads to the accumulation of the urine acids, and accumulation leads to the inflammation and pain and the disease. Also, any questions? Maybe I stop presenting. Yes. Okay, I'm listening. Game foods, yeah. So the game foods are the food which is like which is hunted, yeah. So the food which is hunted, and after this food is used, and this food is like eaten. It's called the game food. So, for example, for example, when hunters go outside and they kill the deer, yeah. So it happens, and they eat this deer. Yeah, it's called like the game food, and it also increases the purine level, and the increased purine level leads to all of these changes we have already discussed. Yeah, game food. Yeah. So that happens a lot. Yeah. So the people who have like the hobby, their hobby is like the hunting, and they go out and hunt on different animals in the forest. That's called the game food. Any other questions? No. So, so you understood everything about musculoskeletal system and associated disorders, so the mechanisms. Oh, very well. So very good for you. Good for you. So you are a very good and capable student, and I'm happy for you, and I'm happy for that thing and that situation and that information. Yeah. So now that we'll do it, I think our today's lecture. So I will say goodbye to you now. So good luck with your studies. Good luck with your exams and etc. And good luck in general in your life. So we will see each other on Thursday on our last lecture, lecture number 15. Yeah. Okay. See you next week. No, not next week. On Thursday. Goodbye. On Thursday, not next week, Thursday. Okay. Okay. Goodbye.